All right, this is who I'm interviewing. This is Jason Staley. He is a nurse practitioner here at McCady Hospital. He has his DNP. He also works at McCady. He works for the trauma services. He also works at IMC in Dixie as a hospitalist. He works here at McKay with trauma, ortho, and neuro, which kind of includes 6 NPs and PAs, and they're kind of overseen by the trauma surgeons as well. He's part of Intermountain Healthcare, and he has been an NP for 4 years. All right, Jason. So if you can think back to when you first started practicing as an NP, what was the one or two of the biggest struggles you faced as you transitioned from an RN to an NP or an NP to a DNP?
I think one of my biggest struggles was learning that the hands-on nursing job wasn't my job anymore.
Mm-hmm.
While you're still licensed and capable of doing those things, it's important to take a step back, let the nurses do their job, and you do yours, which is typically more of the critical thinking and looking at the outside picture, while the nurses do more of the hands-on work. So kind of a role change.
Yeah, definitely. So consider your scope of practice and regulatory bodies within your state. Do you agree with the regulations of your licensure designed by the state? And are there any changes you would make to the credentialing and clinical privileges in your place of practice?
Okay. Some of that's all covered in a couple different ways. Our state right now is one of the more lenient in the nation for nurse practitioners especially.
Mm-hmm.
There still are a couple of regulations that we have to have a physician oversight for. I think, and one of those is narcotics, and that's getting better, and it's in the works of being cleared that it's under our own license. But the other one, it's kind of funny. It's actually durable medical equipment that we're supposed to have an overseeing physician on. Doesn't really make sense to me. I would change that. As far as credentialing goes within my employers, my current employment, it's extremely lengthy. For each of my jobs with Intermountain, it's anywhere from 3 to 6 months of credentialing process. And especially once I'm already credentialed with Intermountain, to get credentialed at another hospital, it's another 3 months.
Wow.
So it's a lengthy process.
Yeah.
And not that I'm doing anything, not that they're doing anything, but my name literally has to go across the board's table, basically. So it's a long time for not very much process, if that makes sense. That there needs to be a more streamlined option.
Mm-hmm.
Like right now, I just barely got credentialed with the IMC hospitalists to just work PRN for them, and it's taken about 3 months. Even though I'm credentialed as a hospitalist at Dixie for Intermountain, I already have credentialing here for trauma. It's literally just because I'm going to a new hospital within the same network that they want to re-credential, and so it's a little bit painful.
Yeah.
But a lot of paperwork, long process.
So what did you mean about like the durable medical equipment? What does that like include?
So technically, if I write for a walker, a cane, crutches, I'm supposed to have an overseeing physician sign. It's one that not a lot of people talk about because it's not that big of a deal.
Yeah.
But it doesn't make sense to me.
That's interesting.
Yeah.
All right. Do you consider yourself working in a collaborative practice?
I feel like in my hospitalist job, I did more collaboration. Here in trauma, I'm here by myself a lot, and there's not a lot of holding hands and oversight in that way.
Yeah.
The trauma surgeons are off doing their thing, and I'm managing my trauma patients by myself for the most part. They're available to answer questions and things that way. But as a hospitalist, I worked very hand in hand with other nurse practitioners, other physicians. It was a very open environment where you could ask questions and help kind of guide each other through this.
Yeah.
Through taking care of a patient.
All right. How often do you collaborate with other professionals? At least you can answer a little bit of that. But.
Yeah, yeah, I think most days I'm working with someone, because I do work with so many specialties. Orthopedics, we help cover for them and their traumatic patients. Neuro, we help cover for them and their traumatic patients. And then so it's a lot of coordinating with them as well as our trauma surgeons, social work, pharmacy. You're always talking to somebody.
And can you provide a clinical scenario where you sought clinical consult with other professionals and now help with the patient's outcome?
And how it helped with the
Yeah.
outcome? I think even just yesterday I had a trauma one come in. He was a motorcycle accident that had facial fractures that, to me, don't look that bad. They're all well aligned. There's no displacement to their fractures. That typically we wouldn't do much with. But in the situation, there was one little spot that we weren't sure on. So we talked to one of our maxillofacial surgeons, who was concerned enough that he immediately came in and took the patient to the OR to fix this one little spot that even the radiologist wasn't able to see, but this maxillofacial surgeon was specialized enough that he could see this one little fracture that was actually communicating between the nasal canal and the cranium. So high risk of infection and things like that. And so it was as simple as putting a patch over that and taking care of it that way, but we would have missed it if we wouldn't have talked to him. So.
Awesome. What is the aspect of your job that you enjoy the most?
Being the adrenaline junkie that I am, it sounds terrible, but I like it when other people get hurt.
Yeah.
But as much as you don't want somebody to get hurt, it is the fun piece of working for trauma. We go down to the emergency department and help run the trauma resuscitations, and being able to critically think in that rushed environment. I find enjoyment in that. I know a lot of people wouldn't. So I like that. As a hospitalist, I really liked being able to focus on each patient and actually being able to talk over things with them, having a little more time to discuss what's going on and working through their problem. So,
what do you not enjoy?
I think anywhere you go in the medical field, there's always going to be politics and drama. I some days just like to come in my office, do my own thing, and avoid it. So the politics, whether it's a physician not agreeing with what you're doing, or you not agreeing with what a physician's doing, or having issues with nurses, or having difficult patients even, that drama piece can wear on you.
Yeah, definitely. I can feel that. And if you were starting college right now, would you still become a nurse practitioner?
I really like what I do as a nurse practitioner. I loved what I did as a nurse.
Yeah.
When I first graduated from school, I worked as a nurse practitioner and a nurse. I loved what I did in the ICU as a nurse. And luckily, after a few months, I was able to actually go back to the ICU as a nurse practitioner for a while before I moved up to northern Utah. And I liked that. But I always told people I work as a nurse practitioner so I can afford to work as an ICU nurse. I still would become a nurse practitioner. I like what I can do.
Yeah.
Looking back at the lengthy road, hindsight's 20/20. I may have gone to medical school. I don't know.
Yeah.
But I like what I do now.
All right.
So that's a roundabout answer, but
yeah. Okay. And that's all the questions I have for you. Thank you so much for your time and for willing to answer my questions.
For sure.